Biofeedback training by any modality. Monitors of various types are used to indicate body responses, which the patient learns to associate with related stimuli and also control in serial sessions. This code applies to any of several modalities of biofeedback training. Biofeedback is used for treatment of conditions including high blood pressure, incontinence, Raynaud syndrome, and anticipatory nausea due to chemotherapy. Hemodialysis procedure with single evaluation by a physician or other qualified healthcare professional. Hemodialysis procedure requiring repeated evaluation, with or without substantial revision of dialysis prescription. Hemodialysis is a process to remove toxins from the blood and to maintain fluid and electrolyte balance when the kidneys no longer function. The procedure involves using a previously placed catheter in an artery or a vein to withdraw the patient's blood, mechanically circulating the blood through a dialysis machine to remove the toxins and wastes, and transfusing the blood back to the patient. Code 90935 applies to one hemodialysis treatment that includes a single physician or other qualified healthcare provider's evaluation of the patient, and 90937 is for a hemodialysis procedure when patient re-evaluation, must be done during the procedure, with or without substantial revision of the dialysis prescription. Hemodialysis access flow study to determine blood flow in grafts and arteriovenous fistulae by an indicator method. A hemodialysis access flow study is performed to determine blood flow in a graft or arteriovenous fistula. The healthcare provider performs the test after approximately 30 minutes of treatment and after turning off ultrafiltration. In the direct dilution method, also known as the urea-based measurement of recirculation, arterial and venous line samples are drawn and the blood rate is reduced to 120 ml/minute. The blood pumped is turned off 10 seconds after reducing the blood flow rate and an arterial line is clamped above the sampling port. Systemic arterial samples are drawn, the line is disconnected, and dialysis is resumed. Measurements of BUN in the arterial, venous, and arterial sample are taken and the percent recirculation is calculated. This code includes the hookup, measurement, and disconnection. Dialysis procedure other than hemodialysis, e.g., peritoneal dialysis, hemofiltration, or other continuous renal replacement therapies, with single evaluation by a physician or other qualified healthcare professional. Requiring repeated evaluations by a physician or other qualified healthcare professional, with or without substantial revision of dialysis prescription. Dialysis is a process to remove toxins from the blood and to maintain fluid and electrolyte balance when the kidneys no longer function. In peritoneal dialysis, a fluid is introduced into the peritoneal cavity that removes toxins and electrolytes, which passively leach into the fluid. Hemofiltration, similar to hemodialysis, employs passing large volumes of blood over extracorporeal, adsorbent filters that remove waste products from the blood. Other continuous renal replacement therapies may be employed. Such as continuous arteriovenous hemofiltration that uses small volume, low-resistance blood filters that are powered by the patient's own arterial pressure, thus eliminating the need for a mechanical pump. Code 90945 applies to one dialysis procedure, other than hemodialysis, with a single physician or other qualified healthcare provider's evaluation of the patient. Code 90947 applies to a dialysis procedure, other than hemodialysis, that requires repeated provider evaluations, with or without substantial revision of a dialysis prescription. Hemoperfusion, e.g., with activated charcoal or resin. Hemoperfusion is a technique to remove toxins from the blood and to maintain fluid and electrolyte balance when the kidneys no longer function. The physician draws the patient's blood, perfuses the blood through activated charcoal or resin, and transfuses the blood back into the patient using a needle and catheter.